Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
My name's Nigel. I qualified from Sheffield University in 2006 and then came back home. I'm from Newcastle originally and did a few NHS just associate jobs and realised that I wasn't the best associate because I was too sort of maybe forceful with my own views. I found it difficult to not have full control. So quite early I bought this practice, which is Seaham Smiles. Bought that in 2010. At that time I was doing quite a lot of postgrad education, did a year-long restorative course and did a few sort of shorter courses as well that allowed me to do more, let's say, interesting treatments than what you can provide under the National Health Service. When I bought this practice, I didn't realise that a truly NHS, 100% NHS practice existed. The chap who I bought it from literally did zero private. If a patient came in asking for whitening, he'd recommend a local practice to do that for them because he was 100% NHS, which was great in a way. The practice was pretty run down when I bought it. It was 3 surgeries, 2 upstairs and 1, we could call it a surgery downstairs, but it was a chair that was in a room that had nothing other than a chair in. The chap who I bought it from had 3 patients in 3 surgeries at the time and would run between the surgeries doing an incredible amount of units of dental activity, but the quality of the treatment wasn't this quality that I was looking for. The practice was pretty run down as well, and so it was quite nice that we could have a full clean sweep of the practice, and so we refurbed it. I brought in an associate, and then the practice has grown from there, from having just the 2 surgeries upstairs. We've now got 4 surgeries, 2 upstairs and 2 downstairs. We fully refurbed again over COVID time, and we're now really pushing towards becoming more and more private. So I decided to move away from the NHS just because I was doing more and more postgraduate courses, and the stuff I was learning on there, it was difficult to implement on within the NHS banding system. I didn't have enough time to really chat with my patients to give them all the options fully, and in going private, it's meant that I've been able to bring in treatment coordinators who have been able to facilitate the conversations that we're having with patients. And so when I was talking through the options with my NHS patients, it was a rushed conversation and treatment uptake was pretty low, and I wasn't able to give the patients what I thought was best for them. Now I've doubled my time to have for every oral health examination that I do, and it's meant that the treatment uptake has been much better because I've been able to fully consent patients and explain to them absolutely what I think is best for them. We did the conversion dentist by dentist, so I was the first dentist to convert, and at the time the practice culture was still sort of relatively NHS. I think we're in an area that's not the most affluent of areas, and I think there was a little bit of reluctance amongst the team as to how well my private conversion would go. I think that there was a belief within the team that the NHS dentistry was adequate because they hadn't seen what can be provided privately. That was 2019 when I converted, and now the whole of the team is on board because they've seen what can be done privately. They've seen the patients go through. They've seen the oral health of those patients improve dramatically through having the time with our dental hygienists, and also having the time for us as a team to educate them and to help them in their oral health. The reason why I decided to go with Practice Plan is because, ironically, they gave me the most pessimistic view of what might happen. We spoke with all the big providers, and apart from Practice Plan, all the big providers said yes, full conversion of the practice is what's needed. I knew in my heart of hearts that actually that wasn't what was needed. in 2019, in fact it was 2018 when we were discussing it with everyone. I think times were very, very different then, and actually in the area that we are in at the moment, there was an excess of NHS dentists. At times we've advertised for NHS patients, and so we had some dentists who had been with us for sort of a year or two, who I think in 2018, 2019 had have converted to private. We'd have lost those patients. Jane from Practice Plan, we discussed with her about what we thought. I didn't lead her into any conversations about what I thought, and she said, actually, I think you're the only dentist that should convert at this time. There are other dentists who aren't far away, but let's do it with you to start with, and then we can use your experience to help the rest of the team convert. And actually that's how it's gone, and it's worked really, really well, and we're getting lots and lots of patients just by osmosis through the training that Jane has done, that's allowed the team on the front of house team to have conversations with patients when they're ringing up, and the treatment coordinators have discussed at length sort of how to chat to patients with Jane, and that's worked really, really well for us. I don't think you'd find a team member here that said they would rather be put in for an NHS day than they would be put in for a private day. We're still a mixed practice at the moment, and some of the dentists are further along the journey of converting than others, and so we do still have days that are predominantly NHS, and I look at the guys who are doing that and think, I'm not sure how I did that 4 or 5 years ago. And certainly the nurses, when they come in and work with me, and when they come in and work with one of our other dentists that's fully private, they say that they enjoy this much more because it's a far more relaxed environment, and they're doing treatments that are a lot more interesting but more complex, and it's just a bit more of a relaxed atmosphere to work in. My kind of stress state being improved is definitely reflected on the rest of the team, especially the dentists, and the dentists can see how much nicer my day is at work than their day is at work if they're working within the NHS, and they are now wanting to make that conversion as well, and so profitability of the practice has gone up pretty significantly, which is great because it's allowed us to do a full refurb on the practice, which means that it's a much nicer place for us to work in, and a much nicer place for patients to be in, and therefore it's a self-perpetuating situation where we're getting more and more patients coming, new patients are referring new patients, because the practice is probably the nicest in the area, and that's all started from my initial conversion over to Practice Plan. So the benefits to my patients are, it is a nicer place to be, but the absolute biggest benefit is that when I chat to my therapists, and they say they can tell without even looking at the name who's a Practice Plan patient and who isn't a Practice Plan patient, because the Practice Plan patient's oral health will on the whole be a lot better than the routine NHS patients that we've got, and that's purely because they're getting the message reinforced every 6 months by the hygienist, whereas the majority of patients who are seeing our hygienist through the National Health Service are there because they've got problems. But also it's the extra time that we've got as dentists to be able to discuss treatment options, to be able to reinforce oral health messages, I should say, and to be able to help the patients, and that's the biggest thing. Ignore the nice building, ignore the better profits. The best thing is my little group of patients that I've got. I come in and I know that they're probably going to be all right because we've got the time to help them help themselves at home. So if I was going to chat to another dentist looking to make the move, which I've done on multiple occasions with my own associates, my advice is do it. I think as long as you're confident in your own abilities as a dentist, and you're looking to provide some more interesting treatments than what can be provided under the National Health Service, then there's absolutely no reason, especially at this time, not to be going forwards. There's the arguments against converting over to private, which were that patients might not go with you, I don't think are valid anymore. There's much more acceptance of private healthcare since the COVID has happened, and so please do it.